Let's talk about signs of perimenopause. I'm Dr. Jen, double-boarded OBGYN and integrative medicine, your hormone and metabolic health expert. So some signs of perimenopause. So perimenopause can occur up to 10 years prior to menopause. So menopause, again, is 1 year without periods or 12 consecutive months. So what are some signs that can happen that you could think, I might be in perimenopause, I should talk to my doctor? So some signs that could occur. First, cycle changes. So your cycle tends to start getting a little shorter. So it might be 21 days, 22 days when it was 26 to 28 days. It could actually start extending to where you have a cycle every 6 weeks, 8 weeks, 3 months. Those cycle changes are all related to this declining ovarian hormones. And so those may be the first signs. Even cycles getting heavier, right? So if they're extended, they could be heavier. You're starting to notice clots. You're having to wear more tampons. Those are all very common signs of perimenopause. And most of that is related to this sort of mismatch of estrogen and progesterone, which is something we can talk about in a different video. But I want to make sure you understand that it could be not only the change in the cycle length, but also how heavy a period is as well. Number 2, feeling kind of edgy, anxious, irritable, like frustrated very easily annoyed by things. That is very common because progesterone works at the brain to help get you to sleep, stay asleep. So that's sign number 3 is insomnia, but it also helps calm you down. It's a very calming hormone. And so when we don't have progesterone, which is usually the first stage of perimenopause, because we're not ovulating every single month anymore, then that progesterone that usually calms us down, helps us feel good, is not there. And so you feel more edgy and irritable and emotional, like crying at Bank of America commercials or, feeling like just really mad about stuff. And, we talk about this hormonal rage. That's true. It feels very frustrating. In fact, one of my first signs of perimenopause was when I came home one day and there were socks on the ground in my living room and I went DEFCON 5 over socks. I was so upset because I felt like someone had put the socks there on purpose. They knew I didn't like a dirty living room. And I felt very personally, someone had done this to me. And that's a very common symptom that people feel because you don't have that calming effect anymore from progesterone. So it could also be apathy, like lack of motivation, feeling depressed, worsening of if you already have anxiety and depression, worsening of that, because these neurotransmitters are so incredibly important. And when they're changed because of lack of estrogen and progesterone, they really can change your mood. 3, you could have symptoms that are related to vaginal symptoms. So vaginal dryness, frequent UTIs, frequent bacterial infections, things just kind of change down there. Your odor changes because of the different microbiome changes. So the bacteria that normally live in this little environment that keep your vagina healthy can actually start to change because of the hormone changes. And then they ultimately lead to differences in you getting more frequent infections, but also having a different odor that can change. Skin changes. So some women experience changes in their skin, not just wrinkles, but kind of feeling like your skin is dry, but also having underlying skin conditions getting worse, like eczema, or maybe breaking out in rashes, things that could happen related to, some of that's related to the immune system changes that actually occur with declining estrogen, but it can also be related to several other factors related to autoimmunity. So skin changes can be fairly common. Some other things that can be common. So sometimes people feel like they have gut issues that have developed. So they're having bloating and abdominal pain, not tolerating foods like they used to. Because again, the microbiome in the vagina changed, but so does the gut. So it's important to understand that these new symptoms that are related to not tolerating foods or having bloating or gas, that's really a change in that microbiome because of hormones. Hormones are metabolized in the gut. So it can be working together into actually causing more hormone issues as well as the effects of lack of those hormones. So those are kind of the common symptoms of perimenopause. I did do a video on unusual symptoms, so you can check it out here. Those are a little bit less common symptoms, but certainly important as well.